So you sent in some medical excerpts on pericarditis.
Yeah,
And I can tell you're really interested in this condition.
absolutely.
We're going to take a deep dive into it.
Sounds good.
Pericarditis. It's the inflammation of the sac surrounding your heart.
It's a good one to know about. It's more common than people think.
Right.
And knowing the signs and the causes, super valuable.
So let's just jump right in.
Okay.
We're going to break down what happens in your body,
Mm-hmm.
explore the causes, and how this thing is diagnosed and treated.
Great.
Let's start with the basics.
Okay.
What is the pericardium?
The pericardium, well, think of your heart, like your fist, right?
Okay.
And the pericardium is like a delicate, fluid-filled balloon surrounding it.
Oh.
It's got 2 layers. It's got the fibrous pericardium, which is the outer layer. It's tough. It anchors the heart in place.
Okay.
And then underneath that, you have the serous pericardium.
Okay.
And this is a double layer. And between these 2 layers, there's a little bit of fluid in there. And that fluid, it lets your heart beat smoothly without it rubbing against your other organs.
Okay, so that's the pericardium, that little sac.
Right.
So when it gets inflamed, that's pericarditis, right?
Right. So this is a normally smooth balloon. It gets irritated.
Right.
It gets inflamed. And this is where we get pericarditis.
So what causes that to happen?
Well, there's a few things.
Okay.
Sometimes it's a virus.
Mm-hmm.
Sometimes it can be linked to other conditions like rheumatoid arthritis,
Wow.
kidney failure even.
Okay.
But the thing is, in a lot of cases, we don't know the cause.
Really?
And that's called idiopathic pericarditis,
Okay.
meaning the cause is unknown.
Interesting.
And that's more common than you might think.
So if you don't even know what causes it a lot of the time,
Yeah.
how do you even know if you have pericarditis? What are the signs?
So the biggest thing is chest pain. And it's a pretty unique type of chest pain.
Okay.
It's sharp. It's right in the center of your chest.
Oh, wow.
And here's the weird part. It gets worse when you breathe in or lie down.
So what do you do if you feel that chest pain before you even get to the doctor? Are there things you should or shouldn't do?
Yeah, if you have any unexplained chest pain, I mean, especially if it's severe or if you have other symptoms like shortness of breath,
Right.
you always want to err on the side of caution. Get medical attention right away.
So that's but how does a doctor diagnose pericarditis?
Well, besides looking at your symptoms, right, they'll listen to your heart.
With a stethoscope?
Yeah, with a stethoscope.
Okay.
And what they're listening for is something called a pericardial friction rub.
A pericardial friction rub. What's that?
It's basically the sound of the inflamed layers of the pericardium rubbing together.
Okay.
Imagine 2 pieces of sandpaper rubbing together.
Oh, I see.
It's kind of like a scratching sound.
So would I hear that if I was the patient, or is it just through the stethoscope?
You probably wouldn't hear it yourself. It's usually only detectable with a stethoscope.
Gotcha.
But it's a key sign that helps them to diagnose.
Okay.
They'll also do blood tests to check for inflammation.
Makes sense.
And they'll use an electrocardiogram, an ECG,
Right.
to look for any changes in your heart rhythm. And sometimes they might even do an echocardiogram,
Okay.
which is basically an ultrasound of the heart.
Okay.
And they can see if there's any fluid buildup around the heart.
So they do all that. They come to a diagnosis.
Right.
What happens then? How do they treat it?
So the good news is most cases of pericarditis, they're treated with over-the-counter NSAIDs like ibuprofen.
Okay.
That's usually enough.
So reduce the inflammation.
Exactly. You're treating the root of the problem.
Right.
Now, if NSAIDs aren't enough, doctors might prescribe colchicine.
Colchicine.
Yeah, it's another anti-inflammatory drug,
Okay.
but it targets inflammation a little more specifically. And then in severe cases, they might use corticosteroids like prednisone.
Okay.
And that really dampens the immune response. And then in very rare situations, if there's a lot of fluid buildup around the heart, that's putting pressure on the heart, they might do a procedure called pericardiocentesis.
Pericardiocentesis,
Well,
what is that?
It's basically using a needle to drain the fluid.
Oh, wow.
But that's only in very, very rare cases.
Okay.
Most of the time, it's just medication.
Okay. So you mentioned earlier
Yeah.
that sometimes pericarditis is caused by other conditions.
Right.
Does the treatment change then?
Oh, absolutely.
Yep.
I mean, if it's caused by an infection or an autoimmune disease, you got to treat that underlying condition first.
Right, right.
That's super important.
So let's say you get diagnosed, you get treated. What's the long-term outlook?
Most people recover fully from a single episode.
Well, that's good.
Yeah. But it can recur.
Oh?
And in some people, it can become chronic long-term.
Chronic pericarditis.
Yeah. So that means the inflammation is just hanging around.
Wow.
Could lead to ongoing chest pain, fatigue, trouble breathing.
Yeah. And so they just have to manage that long term.
Right. It's a lot of medication,
Cool.
lifestyle changes, things like that.
So this has been a lot of information.
It has.
We've covered what the pericardium is, how it gets inflamed, the signs of pericarditis, how it's diagnosed, and all the different treatment options.
Yeah, you've got a really good understanding now.
But I know medical research is always changing.
Absolutely.
So what's something that, like, researchers are still trying to figure out about this?
Well, one of the big mysteries is why some people are more likely to get it than others.
Oh, that's interesting.
We don't fully understand what makes certain people more susceptible.
Fascinating.
It's a big area of research.
Well, this has been a great deep dive. I've learned a lot.
Me too.
I really appreciate your time, your expertise.
My pleasure. It's great to share this knowledge.
You've given us all a lot to think about.
Yeah, keep those questions coming.
We'll be back with another deep dive soon.
Sounds good.